Mornings. Good morning, Doc. All right, so what are peptides and what are people using them for?
I've heard of them, but if you held a gun to my head, I couldn't tell you what it is. Could you?
No, I couldn't describe it.
Yeah.
So there are carbohydrates, fats, and proteins. Proteins are made up of chains of things called amino acids. And if you have a relatively short chain, that's called a peptide. The four of us have hundreds of peptides in our bodies right now that are helping our bodies to work. To
Naturally.
Do what it's supposed to do naturally.
Okay.
Now, there are dozens of them that are synthesized in labs and sold as FDA-approved medications. They include insulin. They include GLP-1 drugs like Ozempic. Fun fact, what's the P in GLP?
Oh,
Peptide. Okay?
Wow.
There are also dozens of non-FDA-approved drugs, peptides that are being sold.
Okay.
And they have all sorts of claims. It's going to get rid of belly fat. It's going to increase healing. It's going to decrease aging. They're also available in creams, but we're talking today about the injectable peptides.
Okay.
So is there proof that these peptide therapies actually work?
Okay, so there's some animal data like rats and mice that suggest that they have powerful effects on cell function, but there's no gold standard, reproducible, randomized trials in humans that show that they actually work. Now, that said, there's lots of anecdotal...
You mean what I saw on the internet is not true?
What?
Tell me.
Surprise.
I spoke to a couple of orthopedic surgeons. They say they think it helps with healing after an operation.
Okay.
And, of course, there's lots of anecdotal evidence. I'm sure there are a lot of people watching out there saying, I know it works, and it may, because it can have powerful effects. It's just not being proven in humans.
Side effects?
All right, that's the big question, right? Anything that's biologically active and can help is biologically active and can hurt. Now, so theoretically, if it's helping with wound healing, for example, they say by increasing cell division and blood flow, well, what is cancer, right? Cancer is when cell division happens out of control. Now, I'm not saying it causes cancer. I'm just saying that's a theoretical risk. It could disrupt hormonal function. So these are the kind of things that you have to be looking for while you need the study.
Do doctors inject patients with this, or is this something you inject yourself? Because who wants to inject themselves with something that has not been proven?
Well, I think people are doing it themselves. I'm sure there are some doctors also who do it. The orthopedic surgeons I spoke to say they don't prescribe it themselves. Other doctors do, and so patients can inject themselves.
We were talking in the green room. I wanted to leave a little extra time for you to cover something else that was on your mind.
Yeah, you know, when they're FDA approved, they can be available in compounding pharmacies that have some degree of control. But there's a gray market out there, and it's like the wild, wild west.
And the gray market is huge.
It's huge. You don't know what you're getting. Is it nothing? Is it something that's dangerous? Okay? Cautionary tale.
Yeah.
You have to look at what is the purpose of the FDA? Because RFK Jr. is talking about making these drugs more available.
Widely available. Right.
So in the late 1950s, there was a drug called thalidomide, and it was used in Europe and elsewhere to treat pregnant women, morning sickness in pregnant women, right? Well, they tried to get it approved in the United States, and a woman named Dr. Frances Kelsey just started working at the FDA, and she said, I don't like the safety data, and she blocked it, okay? It turned out it caused terrible, horrendous birth defects in thousands of infants, okay? She became a hero, and it solidified the role of the FDA. So, in saying, hey, a drug has to be safe and effective.
Right.
So, that raises the question, if the FDA is going to make these things more widely available, then what are the safety studies and the efficacy studies that they're also going to help to have happen?
That makes sense.
Really important
Well said.
details. Thank you, Dr. LaPook, as always.